The following video will demonstrate the correct technique for head tilt, chin lift and jaw thrust airway opening manoeuvres. Once airway obstruction is identified, immediate action must be taken to relieve the obstruction and maintain a patent airway. Head tilt, chin lift and jaw thrust are simple airway opening manoeuvres that can be used to relieve upper airway obstruction in an unresponsive patient. This video is designed to be used by student nurses in conjunction with a practical teaching session and directed reading, and as such is not inclusive of all you need to know before competently performing these skills. Additional learning resources will be identified at the end of the video. Always refer and adhere to local policy in the area where you are working when performing airway opening manoeuvres.
Recognition of airway obstruction. A conscious patient may complain of difficulty breathing. Choking may be noted. Noisy breathing indicates partial airway obstruction, including stridor and snoring. No audible breath sounds or air movement at the patient's mouth indicates complete airway obstruction. Any visible respiratory effort will appear strenuous. Use of accessory muscles of respiration. If present, remove the pillow from under the patient's head. Place one hand on the patient's forehead and tilt the head back gently. Place the fingertips of the other hand under the point of the patient's chin. Be careful not to press into the soft tissue under the chin, as this could compress the airway. Gently lift the chin to stretch the neck structures and open the airway. You may then need to open the mouth slightly. Check the airway for any loose or solid objects which may have caused airway obstruction. If evident, use suction or forceps to remove. Do not place your fingers in the patient's mouth. If a spinal injury is suspected, do not apply head tilt. Excessive head tilt could worsen damage to the cervical spinal cord, and where there is a risk of cervical spinal cord injury, establish a patent upper airway using jaw thrust. Jaw thrust opens the airway by bringing the mandible forward. Identify the angle of the mandible. Place the ring and smallest finger under the angle of the jaw and remaining fingers along the jaw. Place fingers on bone rather than soft structures so that you do not compress the airway. Apply steady upward and forward pressure with the fingers to open the airway. Use thumbs to open the mouth by displacing the chin downwards. Again, check the airway for any loose or solid objects which may have caused airway obstruction. If evident, use suction or forceps to remove. Do not place your fingers in the patient's mouth.
Head tilt, chin lift and jaw thrust manoeuvres are useful in the initial management of an obstructed airway, but all are difficult to maintain. Use of airway adjuncts should also be considered, based on individual patient need. You may now find it useful to watch the related clinical skills video, Insertion of Airway Adjuncts, Oral and Nasopharyngeal Airways.